Hi there, this is Dr. Shaw, and thank you for visiting my YouTube page. Today we're going to be talking about non-surgical rhinoplasty. The definition of non-surgical rhinoplasty is any rhinoplasty methodology that minimally invasively changes the shape and contour of the nose. In current terms, that means that patients come in asking for non-surgical adjustments to their nose. In my practice, that typically involves the use of injectable filler material. Now, injectable filler material can be made out of hyaluronic acid. It can be made out of a product known as Radiesse. Some patients benefit from the use of their own fat. And occasionally, but not in my practice, patients get injectable silicone in their noses, which when done properly can be safe, but I don't believe in taking that risk for patients. The thing that most patients have to understand is that non-surgical rhinoplasty actually makes a bigger nose, and most people who come in actually want a smaller, nicer nose. In my practice, I typically use non-surgical rhinoplasty for very focal changes. If somebody has a very small radix, like in my situation, this little area of my nose right here is relatively small and non-existent compared to the rest of my nose. A little injectable filler in that area could improve my dorsal nasal lines and make things look a little bit more aesthetically pleasing. The other situation that I've used filler material would be after a rhinoplasty or after somebody else has had a rhinoplasty and come in with certain kinds of concerns and considerations, like a mismatch between the dorsum and the tip, or a little depression on one side or another of the nose. Injectable filler can be used in a similar way to caulking material in your house to smooth out contours. Because of that, it's a really good material option for non-surgical management of the nose. One thing that patients need to understand is that they need to be real careful about which product they choose to use for their non-surgical enhancement. I prefer to use hyaluronic acids simply because they do go away completely. They typically will go away within a year of injection. They also don't leave any significant collagen scarring around. The reason I choose this material is because many of these patients who at this point want non-surgical rhinoplasty are going to want a surgical rhinoplasty in the future. And there's been a lot of controversy about using more permanent materials like the Radiesse or the injectable silicone. What a lot of people will find when they go back in to operate on a nose to do a surgical rhinoplasty is that there's a lot of foreign body material in the way, making it very difficult to do a safe rhinoplasty, especially in terms of health of the skin envelope of the nose. If I know that a patient is very definitive about never wanting a surgical rhinoplasty, then I will opt to use a product like Radiesse, and I do find it a very good product for non-surgical rhinoplasty. If you have any questions, you can call me at the office and make an appointment to talk to me more about your options for non-surgical rhinoplasty and to see if you're a good candidate. Have a good day.